Good day, everyone. My name is Lisa Pilgrim. I'm the Regional HIV STI TB Coordinator for the Southeast Regional Health Authority.
My name is Alicia Rob Allen. Presently, I am the Director of Treatment Care and Support for HIV, STI, and TB in the Ministry of Health and Wellness.
My name is Dr. Nicole Webb-McBean. I'm the Medical Officer in charge of the Comprehensive Health Center Sexual Health Clinic.
Hi, I'm Yonique Hansen. I am the Regional Treatment Care and Support Officer with the Southern Regional Health Authority.
I'm Nadine Bigbiswebi. I work in the Southeast Regional Health Authority as a case manager.
My name is Twane Williams, social worker, Clarendon.
Francia Prosperchen, Medical Officer of Health for St. Catherine.
Hi, my name is Jumoke Patrick. I'm the Executive Director of the Jamaica Network of Seropositive, an NGO that provides care and support services for people living with HIV in Jamaica.
My name is Delia Godfrey. I am psychologist for the parish of Manchester, which includes the Mandeville Health Center and the Mandeville Regional Hospital.
Hi, my name is Daniel Perry. I'm a treatment care and support officer at the St. Jacob Park Health Center in the Southeast Regional Health Authority.
My name is Rahana Khan Francis. I'm the Strategic Information Coordinator in the Ministry of Health's HIV, STI, TB unit.
I am Asinto Lati Dixon and I am the Surveillance Officer at the Center for HIV/AIDS Research, Education and Services, CHAIRS, located at the University Hospital of the West Indies.
I am Nicky Mason, the Parish Treatment Care and Support Officer for Clarendon Health Department. And my coverage spans the entire parish of Clarendon and all the treatment sites related.
The impact has mainly been in terms of information, providing information through TSIS 2.0, which is our treatment database that allows us to make programmatic decisions to better achieve our goals as a treatment program.
UCSF has been very instrumental in terms of ensuring that we have continuous quality of care, for example, funding of the evening clinics. They've also been very integral in terms of ensuring that patient services are kept on stream. They've been able to provide support, whether in terms of travel stipend for patients to access care, whether in terms of them also providing patients with vouchers that they may be able to continue to take their medication.
UCSF has been a funding partner for the treatment sites at the Comprehensive Health Center. The partnership has not been limited to funding, but has resulted in capacity building for all team members, particularly through our quality improvement activities that has helped the team to assess, reflect, and plan ways to improve the services that we offer at the site.
Two areas of impact by the UCSF program here at Jane Plus would be one, the engagement of people living with HIV to become peer supporters, retention navigators, working with other people living with HIV in the southern and southeast region of Jamaica. I think that would be the number one significance and importance of the UCSF program here with us at Jane Plus. I think the program, well, that part of the UCSF program allowed us at Jane Plus to use our influence as a community-led organization, to use the capacity, the empowerment, the willingness of people living with HIV to work in the sites that they're a part of, work with other people living with HIV, helping with retention, helping with viral suppression, and ultimately helping people living with HIV to thrive and live positively.
I'll tell you what I'm proud of. I am proud of the high viremia clinic, and I am proud of our adolescent clinic and the support that we got for those two areas.
I think they've had many successes since their start in the program, but I think one that really stood out for me is, pushing the execution of operational research within the Ministry of Health and Wellness HIV response. It has been a shared vision between us and the UCSF, and I think we have finally realized this dream a few months ago rather. And I mean, we certainly plan on continuing in this same path.
For us at CHAIRS, one of the biggest success is how we were able to work alongside with UCSF in terms of doing our PrEP communication program, and we were able to truncate our PrEP process, which is now widely known as PrEP on the go, and also in terms of how they would have used TXML for monitoring the patients, and that has allowed us to basically maintain our cascade and also monitor the clients so that we know who is missing. And another integral part of their partnership with us is also how they encouraged us and helped us to review the prescription end dates for our patients so that we were able to review our internal processes as it relates to how clients, what happens when clients miss their appointment and when they have excess ARV medications.
The biggest success of the program, my mind goes to retention, and I'd also say that collaboration with UCSF as it relates to retention. We had a retention challenge, and the UCSF gave us a contact investigator specifically assigned for retention in the person of Nurse White, and I think that assisted us greatly, and it continues to work greatly for us at our Manchester sites.
What are some of the lessons that I've learned from my UCSF colleagues? Now, I argue with them all of the time, but what they do is they celebrate a lot of the little successes. So they're always there on the site and they celebrate the little things that the team does. So if they see a 1% increase in viral suppression, they'll celebrate it with the team. Based on that, I've learned how to celebrate our little achievements, because usually as a program manager, we're there to look at the gaps and address it. But now I've learned through collaboration with them how to celebrate little successes that the team has achieved. And you know, when we're looking at successes and success stories, we look at those things. How does the team feel? Based on interventions that we've done with them, we've been able to have a staff retreat to basically try and bring team closeness, build team spirit amongst team members. And that's something that I appreciate, because we don't do a lot of that within the government system. So working with UCSF has helped me look at that. Additionally, working with them has helped me look at how I collaborate with persons. So I increase the collaboration that I do not only internally, but externally. And I believe that is some of the successes and some of the ways that UCSF has helped us within SARA.
We're being integral members of the team at Jago Park. I don't think some of the staff know that the people that work at UCSF don't work here. And they actually have the opportunity to understand what it is that we're doing at a site level, and it's not just using the data to tell us, you know, give us ideas, but actually understanding the context of what it's like working at this specific site.
It was great. Half the time, I felt like strangling somebody, but they, I think they tried to convince me that we were doing well, you know. But when you're managing a program and you are responsible for the outcomes of the program, then unless you can see that and it's on paper before you, it's hard to accept it. I liked the spirit of the team and how they were prepared to listen to the problems and brainstorm with us as to how we should get solutions.
I would say impeccable. When I think of UCSF and their dynamics in relation to how they worked with us, I believe that they're like a family that is very functional.
Quite an interesting group. I think they're a good group of experts, and their flexibility, I think, really is exemplary in how they're able to tailor their interventions at a different site level. And, you know, their fun personality, they make learning a very fun process. And I think it really is a change from what our team members are used to.
So the team dynamics throughout the program is very supportive. They play an important role in our site because they are not just from the outside looking in, but they are also within the site and participating in the site.
The UCSF team has a great relationship with our treatment sites. We often call on our funders, not only for funding, but also for technical assistance through the clinical mentors, as well as site coaches that have been assigned.
I think that they have undoubtedly left a mark in terms of the HIV program nationally and also at the site level, because the level of support that they have given to us, especially as it relates to the data review meetings that they implemented at our site, we were able to partner with them and show the team members the quality of work that they would have been putting in and also the outcome of their hard work.
We are talking about people who are not remotely giving us assistance. They are in this space. They are calling us frequently. They are asking the critical questions. What challenges are you having and how can we help?
I'd love for us to see that we're working towards one goal, which is the epidemic control of HIV, and as such, it requires us to work in unison.
My hopes for the future for the HIV program is for funding agencies to be more integral into the whole operation of the program.
So my hope for the HIV treatment program is really as it stands in our national strategic plan. Attaining the 95-95-95 targets and hence epidemiological control of HIV in Jamaica. That means persons who have been diagnosed would have been on treatment, attain viral suppression, and stop the cycle of HIV spread within the country.
As we improve our psychosocial support to our clients, that we will be able to get to the UNAIDS target of 95-95-95.
Currently, I like the crop of people that we have in terms of leadership. I like that we work together. I like that we listen to each other. And I think if we continue along that path, we will reach all the goals that we set for ourselves as a national HIV response.
Well, my hopes for the future of the HIV program in Jamaica is that we can have full integration with our health system, not being separate. Also, no new cases and PrEP being accepted as a preventive measure for Jamaicans.
In closing, I would like to say a big thank you for the collaboration that we've had with the UCSF team. I appreciate everything that you guys do. I appreciate your clinical mentorship with lending me Dr. Blackwood to go out and do audits. I appreciate the support that you give us with regards to our adolescents. I appreciate the support you give us with regards to capacity building, because you do a lot of capacity building for us, whether it be ad hoc or whether it is planned. I appreciate the work that you're doing with the contact investigators currently. And I just appreciate everybody and the UCSF team on a whole, and I look forward to working with you guys as the years go by.